Are you preparing for denial management interview? In this video, we will cover most asked denial management interview questions and answer, including medical necessity denials, coding denials, authorization issues, as well as appeal strategies. In this, we will learn common denial types in RCM, how to answer denial management interview question and answers, pair policy based appeal strategies, as well as real world denial prevention tips. This video is perfect for freshers as well as experienced professionals preparing for RCM AR, denial analyst, as well as medical billing interviews. Watch till the end for interview hacks recruits love, and if you like this session, please click on subscribe button and also click on like button. So today our topic name is top 100 plus denial management interview Q&A. First we will see few basic denial questions. Okay, so what is a denial? See, a refusal by the payer to pay for a claim or service. So basically what is denial? If the payer declines the amount to the service provided by the physician. So usually we will call it as denial. What are the types of denials? So we have two types of denials, soft denials and hard denials. Soft denials are reversible and hard denials are permanent. So if we have soft denials, these are reversible, means we can appeal with the payer. Okay. Hard denials permanent, we can't appeal with the payer. So what is a soft denial? So a temporary denial that can be corrected and resubmitted. So we can appeal with the payer basically. So what is a hard denial? So a permanent denial that can't be corrected or appealed. Okay, so if it is a soft denial, we are on safe side. If it is hard denial, we can't argue with the payer. So what is the difference between rejection and denial? So rejection occurs before claim acceptance into payer system. Denial occur processing. Okay, so rejection means before claim proceeded by the payer system. Okay, so denial occurs after processing. So basically this is simple. Before processing into the payer system, rejection. So after processing into payer system, denials. Okay, so who is a payer? So the insurance company responsible for paying claims. So next, what is EOB? So basically EOB means explanation of benefits, where details of payment are denied by payer. Okay, so what is ERA? Electronic remittance advice. So basically this ERA is the electronic version of EOB, means explanation of benefits. Okay, what does CARC mean? So claim adjustment region code. What does RARC mean? So remittance advance remark code provides additional denial info related to denial. Now we will see common denial reason. So what causes CO16 denial? Missing or invalid information. Okay. So what is CO97 denial? So services included in another payment. So basically it is a bundled service denial. What is CO11 denial? So diagnosis code inconsistent with the procedure. So basically this is the medical necessity denial. What is CO109 denial? So claim not covered by this payer. Submit to correct to payer. Okay. So what is CO22? So coordination of benefits error. What is CO29? So the time limit for filing claim has expired. So basically if the claim needs to be submitted within 1 month, for example. So if we submit after the 1 month, we will get CO29 denial. What is CO50 denial? So non-covered service per payer policy. Okay, so basically if you find CO50 means this service will be not covered by the payer. Okay. What is CO151 denial? So payment adjusted because of eligibility issues. What is PR1? So deductible amount. Okay. What is PR2? Co-insurance amount. What is PR3? Co-payment amount. What is CO18? duplicate claim. So if you find CO18, you need to understand it is a duplicate claim. What is CO170? So payment denied when performed by a provider not eligible for this service. So as we need to remember, whenever the physician performs any type of service, that service must be provided by the appropriate valid physician, okay, or valid provider. So what is CO204? Service not covered under patient's plan. So basically this patient's plan does not consist of provided service. What is CO197? A pre-certification authorization required before the payment. So next we will see few Q&A related to claim process and timely filing. So what is a claim? So a request for payment submitted to an insurance company. So this is common everywhere. So if you want to need or if you want to get your payment, you need to request to the insurance company. We will call it as claim. What are the types of claims? So basically we have two types of claims, paper and electronic. What is the usual timely filling limit? 90 to 365 days depending on the payer. So here basically 90 days, maximum 365 days. Okay, so minimum 90 days, 365 days maximum. So after the service, minimum within 90 days you need to provide the claim. Okay, maximum 365 days. So if you want to claim after 365 days, it is not valued or valid. So next, what is the first step when a claim is denied? Review EOB, ERA for the denial reason. So basically we need to check ERA or EOB. What is the reason for the denial? So next, how do you handle timely filling denials? Provide proof of timely submission, EDA report as well as batch log in order to provide to the payer. Next we will see few Q&A related to authorization and eligibility. So what is prior authorization? So payer approval required before a service is rendered call it prior authorization. So what causes authorization denials? So why do we get most of the time authorization denials? Missing, expired or invalid authorization number. Okay, so whenever we have authorization denial, we need to check for the authorization number first. What is eligibility verification? Confirming patient's coverage and benefits before the service. So here basically eligibility verification is we need to check before the service of patient's details, whether this patient is covered for this service or not. What tool is used for eligibility checks? So in live coding we will use real-time eligibility portals or clearinghouse systems. How to handle eligibility denials? So we need to verify the insurance, correct to payer, update claim and resubmit. So these are the criteria in order to handle eligibility denials. Next we will see few coding and documentation related Q&A. So what is the role of coding in denials? Okay, so basically in denials coding plays very important role. If we submit incorrect CPT or ICD codes which can cause the denials. So what is a modifier? So a 2-digit code that clarifies a procedure. Okay. So in the interview if they ask you, give an example of modifier misuse denial. So missing modifier 25 for E&M with procedure same day. So basically we will use 25 modifier for minor service along with the E&M. So what is upcoding? So upcoding means billing for a higher services than performed. Okay, for example, if the physician takes the biopsy, we can't code for excision. So if they code the excision, it will call upcoding. Okay. So what is unbundling? So separating bundled service to get more payment. Okay. So for example, if the physician performs hysterectomy plus tubes removal, so you can't code two codes, hysterectomy one code and tubes removal one code. You need to code single code for hysterectomy with tubes removal. So that is the unbundling. Next we will see few Q&A related to appeals. So what is an appeal? So request for payer to reconsider a denied claim. So if you have any denials, we need to appeal the payer to check this claim one more time. So that one you will call it as appeal. Within how many days can you file an appeal? So usually 30 to 180 days depending on the payer. So for example, if you get the appeal or if you get the denial, so within minimum 30 days, maximum 180 days, you need to appeal to the payer. So what documents are needed for an appeal? So you need to have denial letter, medical records, claim copy as well as appeal letter. Okay. Next, what is redetermination? So first level Medicare appeal is called as redetermination. So what is reconsideration? So second level Medicare appeal called as reconsideration. So next we will see few Q&A related to follow-up and AR process. So what is AR in medical billing? So AR means accounts receivable, pending payments from payers and patients. What is the role of AR follow-up? So to track and resolve unpaid claims. So what tools are used for follow-up or AR claims? So payer portals, phone calls and billing software. Okay. So how often should AR be followed up? So every 15 to 30 days depending on the aging. Means like duration of the claim. So what is zero payment claim? So claim processed but paid zero, often the denial or adjustment. So this is the zero payment claim. Next we will see few Q&A related to denial prevention. Okay, how can denials be prevented? So we need to verify authorization, accurate coding and clean claim submission. Then only we can prevent the denials. So what is a clean claim? So claim submitted without errors or missing data is called as clean claim. What is front-end denial prevention? So preventing errors before claim submission is called as front-end denial prevention. What is back-end denial prevention? Fixing errors after denial occurs. So front-end is before the claim submission. So back-end is after the claim submission, after the receiving of denial. So who is responsible for denial prevention? So basically whole billing team, coding team, registration and utilization teams are responsible for denial prevention. Next we will see few Q&A related to denial metrics. Okay. So what is a denial rate? So a percentage of total claims denied by a payer is called as denial rate. What is an acceptable denial rate? So less than 5%. What is first pass resolution rate? Okay, so percentage of claims paid on first submission. So without any rejections. So what is claim rework rate? So percentage of claims needing correction and resubmission is called as claim rework rate. What KPI tracks denial trends? So denial region code analysis tracks the KPI trends of denial coding. Now we will see few Q&A related to payer specific Q&A. Okay, so name major US payers: Medicare, Medicaid, Aetna, Cigna, United Healthcare and BCBS. Which payer is government funded? So Medicare and Medicare are related to government. What is Medicare Part A? So inpatient hospital coverage. What is Medicare Part B? Outpatient medical coverage. What is Medicare Part D? Prescription drug coverage. Okay. So what is Medicaid? So Medicaid is a state-run insurance for low-income individuals. So what is commercial insurances? Private insurances like Aetna, Cigna, USC, all are commercial insurance payers in USA. Now we will see few Q&A related to technical and workflow. What software is used for claim processing? Epic, Meditech, eClinicalWork, Aetna and Availity. So what is a clearinghouse basically? So a bridge between provider and payer for claim submission is called as clearinghouse. What is an encounter? So a patient visit or service instance. So for example, if the patient attends or visits the hospital, that is one encounter. So what is a payer ID? So unique identifier used for claim routing. So what is COB? Coordination of benefits between multiple insurances is called as COB. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. So if anyone looking for same-day surgery training, IPDRG coding training, SCC coding training, CCA certification training, please contact 707-526-3939. Now we will see denial analysis related Q&A. Okay. So what is denial analysis important? Or why is denial analysis is important? To identify root causes and benefits or trends. So to identify root causes and trends, we need to perform the denial analysis. What tool can track denials? So Excel dashboard or denial management software. So basically this is based on the company. So what report help analyze denials? So denial trend or aging reports will be useful in order to analyze the denials. What is root cause analysis? So identifying why denials occur to prevent reoccurrence. So root cause, basic reason for the denials. So if we identify the root cause, we can prevent the future reoccurrence. So who performs denial analysis? So error analyst or denial management specialist will perform the denial analysis. Next we will see few Q&A related to scenario based. So what will you do if claim denied for invalid diagnosis? So we need to verify the ICD code, correct it and resubmit. Simple. Okay, but it is better before submitting we need to check the codes. Claim denied for invalid modifier. What next? Add correct modifier and resubmit. Okay, but it will take time. So that is the reason first time only we need to add correct modifier. Denied for no authorization but obtained retro. What next? Attach retro authorization and appeal. Okay. Next, claim denied for non-covered service. What next? Check patient benefits. Bill patient if not covered. So this is the appropriate solution if the physician performs non-covered service. So duplicate denial. How to fix it? So check submission history and ensure unique claim number. So each and every claim is having separate number. So we need to check claim number. Next we will see few Q&A related to audit and compliance. Okay. So what is compliance in billing? So following payer and federal billing guidelines is called as compliance. What is HIPAA? Health Insurance Probability and Accountability Act, which protects the patient's data. What is OIG? So Office of Inspector General monitor healthcare fraud and abuse whenever we submit any claim to the payer or if the payer submits to the claim. Why is documentation important? Support medical necessity for billed services. What is a medical necessity denial? So payer believes service not justified based on the diagnosis. So always whenever we code diagnosis and procedure, we need to check the diagnosis and procedure based on LCDs and NCDs. Next we will see few Q&A related to payment posting. So what is payment posting? So recording payer and patient payments in the system is called as payment posting. Okay. So what is line item posting? Posting payments at the CPT line level. Okay, so this is the line item posting. This is payment posting. What is bulk posting? Posting payments for multiple claims together. What is adjustment? Difference between billed and allowed amount is called as adjustment. What is write-off? Amount provider agrees not to collect from the patient. Next we will see few communication skills the interviewer will ask in the denial management interviews. So how do you handle payer calls? So professionally using correct claim details and scripts. What info do you confirm during payer call? Claim status, denial reason, reprocessing steps. What is the TAT for follow-up? So usually 30 days from the date of submission. Okay. So how do you prioritize denials? By dollar value, payer type and aging bucket. First based on the dollar value. How do you ensure quality in denial handling? Audit and peer review of resolved claims. Next, final Q&A related to denial management. So what is your KPI in denial management? So denial resolution rate and turnaround time or otherwise TAT. So what is your goal as a denial analyst? So minimize denials and improve first to pass rate. So what is your biggest strength in denial management? So analytical skill, payer knowledge as well problem solving ability. Are you able to join immediately? Yes. So based on your flexibility, you can join immediately or after few days. Okay guys, if anyone looking for jobs in UAE, USA and India, please join in WhatsApp group. Group link is the description of this video. And if you like this session, please click on like button in order to create more videos like this.